when there's no doors being closed to them, and I find that amazing.
It's affected my family in a way that we may never be able to thank you.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I'm delighted to welcome Bailey Ressler, who is a health promoter, Grey Bruce Public Health, and we're going to be discussing falls, why falls happen, the impact of falls, and what you can do to prevent falls. Bailey, thank you so much for joining me today. This is wonderful.
Thanks so much for having me.
So I'm extremely interested in this topic as we head into the less than ideal weather for walking and moving around. But you've sent me some questions about falls, so I'll flow through those, but I may add a few others as well. So tell me what you mean by a fall. I mean, I think I know what it means, but what do you mean? Do I have to hit the ground for it to count as a fall?
So when we talk about falls, we're usually talking about losing our balance and ending up on some sort of lower level than where we originally started. Keeping in mind, sometimes people refer to it as a slip or a trip and won't necessarily call it a fall, but all of those things do definitely fall into the category of falls.
Yeah. So if I stumble and I land on the couch, I wouldn't think of that as a fall. But your description is that's a fall because I've lost my balance, and I've had a sudden loss in height from being upright.
Absolutely.
So there's no such thing as a near fall.
I wouldn't say so, no.
Just want to be clear. So so stumbles, loss of balance, losing height, landing on any sort of surface, not necessarily the floor, categorizes as a fall. And that's important for people to know, because sometimes people may say, oh, no, I'm okay. I'm not falling. So.
Exactly. And when you're talking to your doctor or primary care provider, you might say, no, I haven't had any falls, but slipping and tripping and landing on the couch or on a piece of furniture is still a fall, even though you didn't land on the ground.
Great. So tell me about, is it a big problem here in Grey Bruce? What's the burden of falls in Grey Bruce?
Yeah, so many people don't really realize this, but falls are actually the leading cause of unintentional injuries in Grey Bruce. So our local hospitals in 2021 reported about 8,800 emergency room visits and over 800 hospitalizations. So it's about 2 or 3 per day.
Wow.
Yeah. And then here in Grey Bruce, we have the second highest rate of emergency department visits per 100,000 people compared to other public health units in Ontario. And it's about 1.5 times the rate of the province's average.
So it really is an issue of concern here. That leads me to say, why? Why Grey Bruce? Is it in the air? What's happening?
Yeah, we do tend to see in rural areas higher rates of injury just due to kind of lower access to some of those services that might help prevent a fall. That's definitely one of the reasons that we see higher rates of injury in areas like Grey Bruce.
Is it related to age? Sometimes people say, well, seems there's a lot more seniors in Grey Bruce. Is it age related? Is there any correlation with the statistics and falls?
We do see somewhat higher rates in the age category. I believe it's between 65 and 80, but we see high rates across the lifespan in Grey Bruce. It's not all age specific. We see higher than average rates in almost all age related categories.
Yeah, that's good to know because, as we move through our life cycle, you don't want to necessarily have something like falls, and the seniors category connected if you don't have to be. So You mentioned it goes through life cycles, but who is most affected by falls and what is the impact?
Yeah, so like I said, we do see falls across the lifespan, but obviously depending on the age population group we're talking about, we see different risk factors. So like I mentioned, across the lifespan, kind of starting, we look at children under the age of 5. So for them, falls are the leading cause of emergency room visits. Usually those are falls that occur at home. So we look at things like home safety, baby gates, side rails on beds when we talk about what kind of risk factors we're seeing for that age group. As kids get a little bit older, we see them engage in more active play, but they're kind of missing that risk assessment piece. They're not totally able to look at something and think, is this a smart or safe thing for me to be doing? So they tend to have a lot more falls at school, on playground equipment, or in parks, or if they're participating in some of those extracurricular activities. That's when we see a little bit older than kind of under youth aged and older than children under 5. As we get into kind of youth and adolescent, we do see falls occurring as they're engaging in that risky behavior, as well as it's a key developmental stage. So they're engaging in that risky behavior and trying to see what's going to happen. We also do see substance use start to occur in that age group, and that can be a risk factor contributing towards some falls. And then when we move up into kind of the young and middle-aged adults, those are the people we see in the workforce more. So we do see falls that are occurring due to unsafe working conditions. Here in Grey Bruce, we have a large farming population, so some of those falls do categorize as farming-related injuries. And then again, with that substance use piece, we see the increased use of substances contributing to falls. So despite the fact that we do see falls kind of across the lifespan, older adults are at that highest risk for injuries related to falls.
Okay.
Yeah.
So, and that's helpful for me to capture that, falls can happen at any age and stage for any reason, and not always the same reasons. But let's talk a little bit about what happens with seniors and older adults when they fall, because you say they're more at risk for injury. Why is that, and what happens to them?
Yeah, so when we look about how people falls are what we call multifactorial. So it means that there can be a million different things that might cause someone to fall. As we age, we tend to have more of those contributing risk factors. So those can be things like poor vision, low strength or balance, increased use of different medications, maybe some medical conditions and things like that. So that definitely contributes to older adults' risk of injuries. There's a large variation of impacts related to those falls.
So, when you talk about vision, one of the things that I've learned over time is that as we age, our depth perception changes. And often you'll see people perhaps like stumble down steps or coming out of doorways. And I've been advised it's because it's hard to judge the distance because it looks like it's not the depth. And I would not have been aware of that previously.
Yeah, when we look at where older adults tend to have falls, a lot of the time it is at home. It is where we tend to spend most of our time. It's also where you tend to move around without being conscious of your safety. We just assume that our homes are perfectly safe, but we see a lot of falls on stairs and in bathrooms. So those are two places where your depth perception is going to play a pretty big piece. Trying to step maybe over a bathtub ledge into a shower and misjudging that, or trying to walk up and down the stairs and not being able to judge the distance.
Balance and the impact of balance on falls in people. You hear people say, I don't feel as confident in my balance, or I don't think my balance is as good. What's the relationship, and why does that change?
I'm not 100% sure why it changes. I mean, I'm sure there could be a lot of different factors, even things like medications that might affect your balance. Hearing is another one, perhaps some of those hearing conditions that affect your inner ear balance as we age might see an increase in those. I think there's definitely a lot of things that might affect your balance as you get older, but I think it's important to remember that there's also lots you can do to help increase your balance as you get older. So looking at some of those physical activity pieces, trying some Tai Chi, or even just some basic stretching is a really great way to increase that balance as you get older.
So balance can be improved. You just have to work at it sometimes, just like you have to strengthen muscles. Balance is something that you can work at to improve. It's not a downhill slide all the way.
Absolutely. And a lot of people definitely think that it's too late, but we always say that no matter how old you are, it's never too late to start strengthening your balance or working on that building muscle and strength piece as well.
So let's go back to the impacts of a fall, because the impacts are obviously affect the person falling, but there's more than that. So maybe you can talk first about some of the things that happen to people when they fall, and then how that impacts the family that cares for them, the healthcare system, the whole system approach to this.
Yeah, absolutely. So like I said, there's a variety of impacts that individuals might experience after they fall. There's the things you automatically think of, like hurting yourself, so pain, bruising, or even fractures. So those are things that we call short-term impacts. And there's also things that you might not think about. So even if you don't hurt yourself after you've had a fall, you might then be afraid that you're going to fall again. So this can then cause someone to, say if you had a fall while you were trying to exercise, you might then not want to continue to try that exercise because you're scared you're going to fall again. And it causes this cycle of decreasing functional ability. So because you're not exercising because you're scared you're going to fall, your strength and balance might get more poor, and then you might experience a fall. So that's one way that we see kind of the long-term impacts associated with those falls and that cycle that it may create. We also know that about a third of our long-term care admissions are as a result of a fall. So that's some of those long-term impacts and things that we see affect the healthcare system and affect families of individuals that fall too. So then that obviously creates that ripple effect in someone's life and changes the way that their family might be able to see them and interact with them as well. We also know that if you do experience a fall, individuals are twice as likely to have a fall again. So once it does happen once, especially if people don't take some of those fall prevention methods into practice, they're likely to experience a fall again. Other long-term impacts are, say, if you do hurt yourself and it's something more severe, you might require surgery, which could be involving physical therapy or pain medications. So we know that the impact is a lot more than just a couple scrapes or bruises.
Yeah, and it can affect the lifespan of an individual with certain types of fractures and being immobilized. Like it can affect not just the quality of life, but how long you live after some of the falls that can result. So it's important to recognize it as, a risk in many ways.
Absolutely. Yeah, we know that individuals who experience a hip fracture can die within, it's about 28 to 37% of people who experience a hip fracture die within 1 year of that hip fracture as a result of complications.
That's a high statistic.
Yeah, absolutely.
So I want to ask you a little bit about what you would say to somebody who's fallen or their balance is poor and they say to you, gee, I don't really want to use a cane. I don't want to use a walker because somebody's going to look at me and I don't want them looking at me. What would you say?
I would definitely encourage that individual to practice utilizing whatever mobility device it is that they're going to choose, whether that be a walker or a cane, maybe at home or in places that you do feel really comfortable. It is a big change for people to take on. It can be a bit of a hit to your independence to have to rely on something like that. But I think it's just really working on increasing that confidence about using it. And then as you get a little bit more comfortable with it, being able to ease into some of those new scenarios out in public, utilizing something like that.
And having the confidence of having a walking tool may encourage people to walk a little further. And
yeah, absolutely. And it'll
build
encourage you.
endurance. Yeah.
Yeah, it encourages people to participate in physical activity if they're not worried that they're going to fall down.
Yeah, yeah. So it has a spin-off benefit they may not actually realize. But you do, it's not an uncommon thing to hear, gee. So tell me a little bit more about how people can reduce their risk for falls and what sorts of things a fall risk assessment involves.
Yeah, so when I talk about risk factors, everyone has different ones. Obviously, if you're not taking any medications, then you don't have a medication use as a risk factor for a fall. But first, what we would do is kind of go through a list of risk factors that you have and identify different things that might be involved or contributing to your risk of falling. Not everyone's the same. Every single person's looking totally different. But then we'll work through those different risk factors and look at mitigation strategies for it. So if we notice that maybe your vision is being an issue, then ensuring that you're having your vision checked regularly is a way that we'll look at mitigating that one. Reviewing medications with a doctor or pharmacist, so flagging any side effects that you might be experiencing, and looking at lowering doses when possible or getting rid of medications if they're not needed is one way that we look at mitigating the risk associated with medication use. And then we look at things like home safety and footwear choice and things like that that are a little bit easier to change. So making sure people are wearing supportive footwear or anti-slip footwear. Also in the wintertime, like we are creeping up into that season when it gets a little scary to walk outside for everybody. So making sure that you're wearing appropriate footwear for the wintertime or using walking poles if that's something that you need to be able to keep your balance and increase that confidence. When we look at your home, like I said before, a home is somewhere where we tend to walk around without thinking about our safety. But it's important to remove tripping hazards and improve lighting to make sure you're able to see things. Because even if you have a rug and you don't see that it's wrinkled up or something like that, you're going to trip over it regardless of how safe it might appear to you. So removing rugs, cords, anything that might be a tripping hazard, making sure you have secure railings on your stairs, grab bars in showers, and anything else like that you might deem necessary. Those are kind of the physical pieces that we look at, as well as if you were requiring a cane or a walker or something like that. Trying to utilize something like a mobility assisted device as well. And when we look at kind of those longer term pieces about how to reduce your risk of fall, that's when we move into that exercise, strength and balance piece. So challenging your balance, building strength. There's lots of exercises that you can do to strengthen your leg muscles, which can really help to improve your balance. We encourage activities like Tai Chi and yoga, so they don't seem to be quite as intense for people to start out with as well. So we try and encourage about 30 or more minutes of moderate to vigorous activity at least 5 times a week. And I know that can sound really daunting for people, especially starting out, but anything's better than nothing. And it doesn't have to be something extremely rigorous. You can just walk, garden, bicycle, swimming is a really great one as well. And doing activities that you enjoy is a really great way to make sure that you're going to continue to do those things. Because if it seems like a chore, then you're probably less likely to do it. Yeah. The last thing I really like to encourage is just to remind people to slow down. We find that we're rushing around, and that's when we make mistakes. And oftentimes when people are telling me how they had a fall, that's one of the things that they always say is, I was rushing to do something, and that's when we hurt ourselves.
Yeah. I certainly things like if the phone rings and you can't get there in a reasonable time, let it ring. People
Exactly.
will call you back. Yeah. Couple of things. It's always interesting to me in stores that sell scatter rugs, that they look lovely, but they don't always have rubberized backing. Do you recommend rugs that have rubber backing if people insist on having scatter rugs?
Yeah, I definitely recommend rubber backing. There's also something that's similar that's almost like a weighted rubber backing so that it doesn't have quite the risk of having it flipped over on the corners, just to try and keep those corners down, because That's the kind of stuff that poses a simple risk to anybody. And it's not just for you. I think that's what people have to remember. Like, well, I know the rug's there, so I know I'm not going to trip over it. But you might have visitors into your home and the rug gets flipped and someone's going to hurt themselves. So definitely the rubber backing or those weighted rubber pieces that you can get as well is a really great way if you insist on having some sort of scatter rug in your home.
Yeah. And for some, scatter rugs are a way, in certain areas where water might be spilled, then it absorbs the moisture, but having a rug that slips is pretty much at risk. During COVID, people couldn't get out to exercise, and some online programs were then offered. And I'm wondering, there may be people who have transportation issues, can't get out to activity classes. What are your thoughts about the online exercise programs, and are there any that you might guide people to research?
Yeah, coming out of the pandemic, we do see a lot more of that stuff shifting back from the online space into in-person events again. But it's definitely a really great way to keep people connected. A big piece of that exercise class kind of participation for people is also the social aspect of getting yourself out of the house, which we did see a huge barrier to during COVID, of course. There is some really great resources it's a website called Finding Balance out of Alberta. And they have some great simple exercise videos for people that they can do at home. I think we see people start off at home a lot of the time. And then once they get a little bit of confidence, then they would look at something a little bit deeper, like an in-person exercise class.
Mm-hmm. So for people to stay fit, just walking around the block, there needs to be a combination of things to help them with balance and strength and mobility. Just walking is not enough, correct?
Walking is a great place to start. I think one thing that we try to encourage is that you incorporate different types of activity, because that's going to engage different muscle groups and strengthen different parts of your body and build balance kind of all over. So it's definitely, walking is great. I would never tell somebody that that's not enough. But it's really good to try and get some of those different types of exercise in to work towards strengthening some of those other muscles.
Yeah, which is really helpful for sure.
Absolutely.
Now, we may have just missed it with timing of the program, but there is a fall prevention month each year, correct? Is that in October? When is fall prevention month?
Yeah, so fall prevention month is November.
Oh, we haven't missed it.
Yes, so we're in there. It's perfect. So Fall Prevention Month it's a national awareness month for fall prevention. This year is actually the 9th annual campaign. It's sponsored by Parachute, which is Canada's national injury prevention charity. The campaign's designed to spread awareness about the burden and impact of falls, as well as promote fall prevention strategies for people across the lifespan, and also look at fall prevention strategies that healthcare providers can work to encourage their patients to use as well.
So it's a way to really focus on fall prevention, but to involve people as well. That's available for research and looking up year round. What other organizations do you work with as far as working on fall prevention or fall prevention strategies?
Yeah, so we work, a group of us work together. It includes representatives from different family health teams, as well as the VON. The VON does have, it's called their SMART classes, which is seniors maintaining active roles together. And that's a fall prevention-based exercise class. So we work closely with them as well. We see partners from across the continuum of care. So some of those home and community support services representatives, as well as just other healthcare providers that are involved with patients who might be at risk of experiencing a fall.
So certainly it's a collaborative effort and everyone's working together. One of the things, and perhaps you can speak to this in the last few minutes of our program, sometimes when people have a tumble, stumble, or a fall at their home, they're very hesitant to tell their family or anyone because they're fearful that maybe people will think they can't manage at home. What would you say about that, and what would you say to them?
I think it's a very valid fear for someone to have. You never know necessarily how an individual's family is going to react to something like that. And I think it's a fear for all people as they age, that one day they're not going to be able to stay in their own home and they're going to have to go somewhere else. But we just really encourage people to make sure you do tell someone. When we look at some of those long-term impacts, things can go missed, and you might not realize that you've hurt yourself a little bit more severely than you have. Or if you've hit your head or something like that, there's kind of some of those longer term effects that we can see. And if you don't tell somebody, chances are those things are going to be a lot worse.
Yeah. You had mentioned earlier about medications, and one thing as we age, our physical ability to handle certain medications may change. And I know there are concerns with physician shortages. Not everyone has a physician, so they may be on medications or whatever. But you also mentioned they can have a pharmacist review their medication. I think there was a phrase, polypharmacy, about this, which means lots of things together may interact. So a pharmacist could provide that service as well. Would people have to book an appointment? How would they do this?
I'd recommend you call your local pharmacy to check. Some of them are available to do it by walk-in, and some prefer an appointment. But it's a program called Meds Check, and it's a way that you can have your medications reviewed by a pharmacist and go through any side effects that you might have, look at different ways you can mitigate some of those side effects. And it's really just important to review medications to make sure that you're not on anything that you don't need to be on, or something's gone missed or anything like that. So we recommend going through it annually, and the Meds Check program is available for people to use. I think it's once per year with their pharmacist.
So that's a really, really good strategy for sure. Is there anything I haven't asked you that you can answer in the last 2 minutes?
Yeah, I would really just encourage people to take a look at some of the information you might see out there for Fall Prevention Month, or if you don't see any, if you're a healthcare worker looking for any information on Fall Prevention Month or just fall prevention in general, there is the Loop Community of Practice, which is at fallsloop.com. It's a network of healthcare providers all working in fall prevention in some sort of way. And the website's a really great way for everyone to connect and share resources. For anyone, a member of the public interested in learning more about fall prevention or Fall Prevention Month, we'd encourage them to visit fallpreventionmonth.ca. You can also visit the injury prevention section of the Grey Bruce Public Health website, which is under the Your Health tab. And there's information there on fall prevention strategies and just some other really great resources for individuals to take a look at as well.
That's really, really helpful, because, oh, well, it's not going to happen to me. It could happen to anyone, right? So the more you learn, the more certainly you can do to prevent falls, and that's really critical. I really appreciate the time that you spent with me. I've certainly learned, and it is something we need to be mindful of as we go forward. So thank you so much for sharing this information, and I look forward to seeing you again.
Thank you so much for having me.
My pleasure. Thank you as well to our viewing audience for joining us today to learn more about programs, resources, and services available to you and to your family. Take care and stay safe. Thank you.
Call the Rogers TV viewer response line, email us, or connect with us on social media.